October 22nd, 2025, Town of Littleton Board of Health meeting. I am Vice Chair Matt Wason, and with us we have board members Gino Fratelloni and Dan Kane. Apologies, they are both in situations where they don't have video feed tonight, but they are here in an auditory fashion, and our Health Director, Francis Daigle. We have a quorum, so we will get started. 7 p.m. agenda item is a discussion on tobacco regulation amendment. Francis, would you like to kick us off, please?
Sure. So in 2018, this regulation was amended last. In 2019, the state came out with new regulation and an act to modernize tobacco, basically looking at vaping and flavors. And then in years subsequent, they have been making little tweaks to the regulation along the time. So if you look at the version in front of you, it's a red line from what we had in 2018, bringing you up to date with 2025. I would only note that during our inspections for the tobacco establishments, we are following a 2025 standard, but basically we just want the regulation to now match what we're inspecting. Two key things to look at would be whether we want to restrict or put a cap on tobacco establishments. There's also the question of a smoking lounge, tobacco smoking lounge shop where you can go and do whatever. Sorry, I got a little background noise. So it's a lot, but if you have any particular questions in the regulation, I'm happy to answer those, or we can go it through page by page, whatever you want to do.
It's a lot of change, it looks like. So do you just want to go page by page? We don't have to go line by line necessarily, but if you could you just summarize page by page?
Yes, I'm having trouble opening up the packet. Is my only issue here. My OneDrive is not working or anything.
I can share it. Let's pull this off. So have it open here. Maybe there it is. Okay, can you see?
Yep.
Okay. So obviously this is the start of it. So red line is additions done generally since 2018, but ours is all ours is from 2017, you said?
So it's amended in, I think, February of 18.
Okay. So this has a lot of red on it.
So yeah, we're gonna have a lot more definitions in this version because they basically extended each section that we had.
Okay.
So I mean, it's for the statement of purpose. Basically, you're looking at updated information, but also updated links. So on our 2018 version, obviously, we had links that were used at that time. So these update the links that are being used and connect to the thoughts of the purpose.
Okay, so most of this is just new definition items? Okay.
Updated links showing studies and causation, etc.
Okay. I have small pictures, so if anybody wants to chime in, please just say something so I can hear you. Anybody have any questions or comments on this page?
It'd be nice if everybody stopped smoking, but the question is, it doesn't work.
I don't disagree. It would be nice if we didn't have to have a regulation at all. Okay, so page 2 looks like continuation of the purpose statement at the top.
Mm-hmm.
And then it starts number 1 right here, U.S. Center. What is that? Is that a new section or that's still part of this purpose?
That's the footnotes for the sites for the purpose.
Got it. Okay, that makes sense. And so then the lined out section here, is that just all been expanded upon higher up?
Yeah. So it's the same as the purpose, just expanded.
Okay. Okay. And so then we have a long list of footnotes. Which brings us to page 3. Authorities unchanged. Definitions. Talk to us about what's going on here.
So basically there have been a lot of definition additions since 2018 because now they have an act. So, I mean, you're looking at a more full-fledged outlook of tobacco. So originally it was only looking at more of cigarettes and cigars, blunt wraps, what have you. And now the tobacco industry has gotten larger in alternative projects. So a lot of this looks at vaping, flavoring. So that's where all the changes kind of come in, is to broadly define what all these little intricate pieces are for the next sections.
Okay. And just because I'm curious, the second green bar there says the entrance to the establishment must be secure so that access is restricted to employees and of age. How is that secure access controlled?
So I forget what the green is. So there's green and yellow highlights. I think green is...
Let me scroll back up to where that said that. So green is uniquely local.
Right. Okay.
And yellow is copied from latest state law. Okay.
Yeah. So anything in green is something that we might want to decide collectively what you want to put in there and what not to put in there.
I see. Okay,
So
then I guess we should spend a little more time on the green sections then.
Yep.
Okay, then let's back up to the first one, which is, this is talking about adult-only retail tobacco stores. And this has a clarification added of that has a separate entrance.
So as of right now, we only have tobacco sales going through basically our gas stations. We do not have any specific adult tobacco retail.
Okay. So does it help to have that block of green language as opposed to it just saying establishment that is not adjoined whose only purpose is to sell or offer for retail sale, etc.?
In this case, I would say it's not necessary.
Okay.
Sorry, is that because we don't have anything currently, or we don't expect to be able to? We don't expect to license that kind of operation, or because we want the regulation if we can, just to address likely scenarios. So I would hate for someone to say, "There's no regs, so I can," or "There's no, you can't control anything that we do because you never wrote it."
Right, Dan. I'm saying, although we don't have these, let's keep language so that if we ever get one, we have the language to cover it.
Right.
I'm more just asking, do we care that an adult-only retail tobacco store is defined as an establishment whose only sole purpose is to sell or offer tobacco, or an establishment that has a separate entrance not used by any other retailer, that does not sell food, beverages, or alcohol, that does not have a lottery license? So I'm trying to understand if that extra language is necessary or if it's still sufficient to say, whose only purpose, I don't care about anything else going on, whose only purpose is to sell or offer for retail sale tobacco products.
No, I get you. Okay, sorry about that.
Yeah. And Francis, you feel like, yes, just skip that?
That's my opinion. Can't think of any instances where that would change anything.
Okay. Yeah, no, I mean, I want to hear your opinion on it, because if we don't have a reason to not follow it, then we'll just go with that. So then the next green block was the one I asked about first, was the entrance to the establishment must be secure so that access is restricted to employees in those 21 years or older. And I was just curious as to what that means in other places that have this.
So that would typically mean like you have to hit a button to get entry. They would look at you on a camera, make sure you're kind of age, and then they check your license when you come in.
Okay.
So like a dedicated smoke shop.
I have no problem keeping that.
I would
Anybody
agree.
else?
It's a good precaution.
Yeah. Anybody else have an opinion on that?
No, I would agree. In my previous town, we had a smoke shop only, and they had that same kind of, kind of jewelry store, hit the button to let people in. I think that's
Yep.
appropriate.
Exactly.
Okay. Now you mentioned, even if it's somewhere else, tell me. You mentioned, Francis, about the procedure for validating ID on entrance. Is that? I don't see it mentioned right here.
That's a good thought. Yep. So basically what they do is they'd ask for your ID. They wouldn't scan it, I don't believe, but I'm not sure entirely. They might have a scanning machine, but they at least check the ID itself.
Okay. Can you make a note? Because I think that should be called out specifically, because I wouldn't want somebody to say like, oh, well, they browsed for 15 minutes, but then we didn't sell to them because they weren't 21. It's like, well, you already broke the rules because they came in. So
Yep.
I think specifically calling out that identification is established, upon customer entrance, something along that line, just so that there's no wiggle room around that.
Okay. I'll add to that section right there.
And then obviously not allow anybody under the age of 21 to work there. So next screen section is about blunt wraps.
It's up to the board. I mean, a lot of towns have prohibited blunt wraps. I think it's a good common sense measure, but it's been one
These
you want
are
to
just
restrict.
definitions, correct?
Yes,
These are just definitions.
but they're going to tie into sections where they will prohibit or restrict in some way. So
Okay. Yeah. But to Kevin's point, the definition's fine. We keep the definition. We want to have it somewhere, right?
Yeah, we're in the definition section for a long time here.
Yeah.
Yeah.
Okay. Then bona fide purchaser for value.
that's a pure definition.
Okay. And yeah, to your point, this is all definition stuff. And footnotes. And now the yellow stuff is you're saying from 2025 DPH.
Yep, basic model language.
Okay. Any call outs?
I personally think we should be accepting anything from the DPH from 2025 and just put it right in our regs.
Yep.
Yeah.
I don't disagree. That brings us down to the last green block under healthcare institution, a final sentence. Retail establishment that provides optician, optometric, hearing aid, or audiology services, but is not subject to regulation by the Board of Registration and Pharmacy, shall not be considered a healthcare institution. Why
Can't
is
wrap
that
my head around that one.
tobacco product regs?
Sounds okay. I don't really know.
Okay, cool. I guess that doesn't really bother me here.
I mean, we'll have a meeting in the future, so anything that we note now, I can bring up at a future meeting. So
that's just one of those like I guess maybe if we miss it today, can you please go and figure out where this comes up later? Because what I don't like is some random regulation referring to healthcare institution, and then we do something else somewhere else someday, and we have a different definition of a healthcare institution, for example, and somebody comes back and says, well, this reg defines it this way, and this reg defines it differently.
great point. Yep.
So if this comes up later in the reg and we miss it, then fine. I want to understand why there's a connection, but I'm curious as to why it's in the tobacco reg. So I will keep going for now. Still under definition. So this green 1 through 7 is all a part of manufacturer documentation.
Yeah, so right now we already kind of follow this during our inspections, so I would say we accept all of it.
Okay. And then there's a couple strikeouts. So minimum legal sales age. Is that just replaced somewhere else with more robust language?
Yeah, because I mean, 21 was the age cutoff in the original reg, so this is the same statement pretty much. So I think it was just changed language.
Okay. And then oral nicotine pouches. Again, that just seems like a definition, so that makes sense that we have a definition for that.
Yep.
We're going to no longer define what a person is, apparently.
They get into person versus retailer and distinctions in between that.
Okay. And schools. And then we have, again, rolling papers as a new definition.
Pretty
And
straightforward.
schools is now just appropriately listed in alphabetical order. Love that. Smoking bar, another new definition, again from DPH, so I wouldn't have a problem just keeping that as a definition. And then tobacco product flavor enhancer.
I would say the green part makes sense with the first part.
I would agree. Adding the fact that a flavored paper counts as a flavored product enhancer.
You can make a note.
Yeah, no, I'm just agreeing that that's what it's basically saying. So,
Yeah.
Yeah. Okay.
You can look at the language though.
Okay. And vending machine. Love it. Okay, so now we get to 224-4. So, tobacco sales persons under the minimum legal sales age prohibited. What's the blue color here?
Oh, I think blue is they erased it, but I don't know why they would erase it.
Okay. So Yeah, I mean that's language about just kind of saying it's adding a little bit of diameter to the responsibility.
Yeah.
So what it's cutting down to is it's saying no retailer or person shall sell or provide a tobacco product to a person under 21 years old.
Correct.
Yeah.
But we had additional language or the regulation used to have that included or permit tobacco products as defined herein to be sold to a person under the minimum legal sales age or not being the individual's parent or legal guardian give tobacco products as defined herein to a person under the minimum legal sales age. Now, technically, by taking out the blue, it becomes more strict. So technically, with the blue language, it seems to imply that a parent or legal guardian is allowed to give tobacco products to somebody under the minimum legal sales age. Without the blue, that is saying a parent or legal guardian cannot, because it would say no person shall provide tobacco products. I'm not upset by that, but that is a difference in the language that would come out of that. It's simpler, but it's the adding the provide tobacco products to that underage individual. So, thoughts from the board?
I think my only
assume. Go ahead, Dan.
Go ahead, Dan.
No, okay. I was gonna say,
We lost you, Dan.
oh, sorry, I wasn't sure who's up.
Go ahead, Dan.
Sorry about that. So, my question, I think I'm with you with removing it is probably okay. I think my only question would be, are there any situations where a parent may appropriately provide to their child? I'm thinking, are there any religious ceremonies or situations or those kind of things where we may not want to limit it? I don't know. That's the only reason I can think why it might want to stay, is if we can think of a situation where a parent to child transfer would be reasonable. I'm not sure there is, but otherwise, healthcare provider says get rid of it. I just want to make sure we're not missing something else that might be rarer but still there.
No, that's a very good point. Kevin?
I just assume take out the blue and just have that one sentence: no retailer or person shall sell or provide a tobacco product to a person under 21 years old. Just cut and dry. I feel like that last tagline there, the red, to a person under 21 years old, was the end of that sentence before the blue was pasted in there. I don't know.
Yeah, that would be the updated version. Yes.
I don't know. We need all those words, but whatever you guys want to do.
So I just scroll back up just to glance at the tobacco product definition, because that's what it's referring to. It does have the kind of endpoint that tobacco product does not include any product that has been approved by the US FDA for the sale or use as a tobacco use cessation product, or for other medical purposes, and which is being marketed and sold or prescribed solely for the approved purpose. So that addresses any medical coverage of a tobacco product that would bypass this statement. But to Dan's point, there's no call out of any sort of cultural scenario that I think warrants a follow-up question. Like Kevin said, I'm all okay with just making it just a blanket statement, but I think it would be poor of us not to at least ask the question. So, Francis, could you kind of do a little exploration and maybe actually just call the DPH and say, is there no sphere where there is some minor usage that would be permitted?
Okay.
And I think if at the DPH level they say, nope, we've found no reason that minors should be allowed in any scenario, then I would feel comfortable with that.
Okay.
So required signage is up. There's a lot of cross out and some new language.
It's just updated sign language. It's already been adopted in the establishments that we have. So,
okay. The green part, signage may be in a form developed and made available by the Mass DPH. Like, that's just saying they're allowed to use DPH signage, not our specific signage.
Yes. Originally, we had to provide certain language. Now we don't.
Okay. Let's see here. Is this still okay? So yeah, signage. This is still signage. 2 and 3 are both still additional signage stuff. I'm not going to dive into it unless you call out that something should be mentioned.
No.
Okay. Identification. Oh, this gets to what I was asking about probably. Each person selling or distributing tobacco products is defined here and shall verify the age of every purchaser of tobacco products by means of valid government issued photographic identification containing bears date of birth that the purchase is 21 years or older. Yeah, no, I still. Oh, yeah. Each person admitting interest into a smoking bar or adult-only retail tobacco store shall first verify the age of every person entering. So that's what I was referring to earlier. Great, it's down here. So that's fine with me.
But we want to further define what identification means, or
No, I think it's. I think since it's called out here as a part of your process, I don't think you would have to add it way back up here as an adult-only.
Yeah,
wherever
okay.
it was, because this is just the definition of an adult-only retail tobacco store. Period. So this is the process by which somebody would get entrance, and so I'm okay with that. Tobacco products sales permit. Only owners of establishments with a permanent indoor, non-mobile location in Littleton are eligible to apply for a permit and sell tobacco products. Was indoor not there, and we want to add it?
yeah, I think they're more referring to smoking bars.
Okay. Okay. And then under section C's, just some update.
Yep.
And section D, all required Massachusetts Department of Revenue licenses related to the sale of tobacco products as defined herein must also be displayed conspicuously at the retail establishment.
We already require that.
Okay. This continues under, sorry, I keep going up a little bit here. Tobacco product sales permits continue down here. There's a lot of green. Can you summarize what's going on here?
Yeah, so the first one is going to dive into what allows a renewal. We kind of already have a process that's based on probably what's green here,
Okay.
with like a three strike policy. Yeah, so just further restricts, which we already do per the inspections, where they get a finding system and it increases each time, and then there's a question of whether it should be renewed.
Okay.
This one, right? So retail density. Right now, that in the first one, H1, right now the feet is what we have on the books right now. So it's a question of whether you want to change that. I mean, based on 25 King Street near the high school, I don't know if that's going to be affected.
Well, it wouldn't because this is for a new permit, right?
Oh, sorry. Yes, you're right.
But it's anytime there's one of these things, honestly, I would be best served by looking at a map and seeing how big 500 versus 1,000 versus 2,000. I mean, I don't have enough sense as to each of our school locations as to what the impact may be. And it might not actually be that much of a concern based upon their physical location.
I mean, this is going to dive back into if you want to do a cap versus new versus old grandfathered permits. So it might be something to come back to in a formal meeting. I can get you location distances and things like that.
Yeah, I think just looking at that, just looking at an overhead map and saying this is a 500-foot effectively circle, I think would help this board look at it and make a decision that seems reasonable.
Sure.
Francis, you might want to take a look at the regs we talked about with the, I think it's the Leominster Coalition Against Tobacco.
Mm-hmm.
We had called out, the maximum number of tobacco sales permits in town. I think
Okay.
it was like maybe 10. And we also made a decision that we weren't going to issue any new ones.
Okay.
And that's all in those documents.
That's a good point. I
Um,
was going to bring up the Tobacco Control Alliance and just say, like, what's their opinion? What's their input?
Because we did vote on some local regulations when we met with them.
Okay. I'll follow up with them. Most towns do typically say what we have now is the cap, and we do not go above and beyond that, which I'm assuming is probably what happened.
Okay. Just because it came up now, and are they still doing their
Inspections.
visits and such, and still do analysis for our town establishments?
Yep.
Okay.
On top of it. Yep.
Cool.
Cheryl Sparra.
No, it's I think it's Joanne is her name. Cheryl's from MAHB.
Okay, so transfer business is permitted, and then maximum number of permits. That's what Kevin was just referring to. So let's kind of follow up with what we think we might have decided already with the Tobacco Healthcare or Control Alliance. That affects all of this. So prohibition of smoking bars, they are prohibited.
Okay.
That's what this says. Is that what we've had?
We have not.
Okay. Thoughts from the board?
Do we have any improvement for the children avoid smoking and trying to buy cigarette?
So that will be addressed for the restrictions on who enters an establishment and how we verify those IDs to make sure we're in compliance. The board has also upped the age to 21, so that helps prevent further smoking in futures. So
It's good step.
Is anybody against the prohibition of smoking bars in Littleton?
I don't know. I don't go there.
We don't have any right now. So it's a question of, do we want to just say we will never have one, or do we want to leave the language out and leave the door open? Is anybody for the prohibition of smoking bars in Littleton?
If you can help a young boy that is minus, maybe that will help. They're going cigarette, they go get the beer, and then all of a sudden somebody give them a cigarette. The question is, these young men today, they wanted to do whatever they wanted to do. You know that. We try to do the best we can for their own good. Sometimes they listen and sometimes they don't.
So this specifically, Gino, would make it so that there are no smoking lounges in the town of Littleton. So there would be no space where they could go and smoke like that.
Yeah,
So
that's
the
good.
question is if you want to restrict that.
That is good.
Okay.
So if somebody wanted to open a private cigar bar, this would say, no, you can't do that. We no longer have any licenses for you to sell cigars, and we do not permit private establishments to have indoor smoking. Go ahead, Kevin.
Does this pertain to cannabis?
It does not. So the CCC would lay out the regulation for that. We're just focusing just on tobacco.
Tobacco only.
Yep.
Yeah, tobacco's bad.
Pardon, what was that, Kevin?
Tobacco's bad. I don't think we should have a smoking lounge.
Okay, so sounds like at least Gino and Kevin are in favor of saying we can have a prohibition. Dan, do you have an opinion either way?
I think a prohibition in concept is fine right now. Obviously, we can't enact any of these without a public hearing, but I don't think there's a lot to be gained either financially or public health wise by allowing it. So no, I think we're okay without it.
Okay. Yes, Dan is correct. This is simply a discussion. We're not making any final decision. I just wanted to make sure we're kind of on the same page on some of these because this is the exact kind of very short 2-line language in a regulation that people may miss in a public hearing until some ways down the road somebody goes, wait, what? How did that get in there? I think we're all on the same page. Let's keep that language in there, Francis. But it's definitely something new that I think we should be fair and make sure we don't just gloss over it and try to say, oh, it's been there the whole time.
Okay.
So moving on to oral nicotine pouches. This, again, new section, new language.
Yeah, so we're looking at nicotine content at this point. What is shown to be more dangerous.
Nicotine, yeah, that's good.
So this is a specific restriction saying we're going to, well, which one do we feel? Do we want to have one that just says you can't sell nicotine pouches with a high content, or it can only be adult-only retail tobacco stores?
Most towns have adopted a cap on the milligrams.
Okay. So the first sentence.
Yep.
And I'm a bit out of date on my oral nicotine products. Is 6 megs per pouch kind of a standard, regular strength, light, extra crispy?
I've heard extra crispy, yeah. I've heard up to 55. So yeah, 6 I guess would be mild. We can do further research on that for the next meeting as well.
And who's selling pouches in town right now? Is it pretty much anybody with a tobacco license can?
Yep. I think all of them do, actually.
Okay, and right now there's no restriction on content or anything like that?
There is not.
Okay. Yes, I would appreciate, obviously a little time consuming, but I think it would actually make sense to go to our retailers and kind of inquire as to what kind of products they're selling and how they would feel about that.
Okay.
I mean, I would love to, say none at all, but I also respect that, we do have some businesses and we have a lot of regulations already. And so if our retailers are saying that,
yeah, the retail, yes,
isn't that big of a deal, or gosh, that's half of my sales, what are you doing? I think it at least warrants conversation.
I think they do the best they can when the people they're trying to sell cigarette. That's nice.
Well, yeah, exactly. That's I'm on the same page. Obviously, I would love it if nobody used any of this stuff, but let's try to be responsible, but take maybe some smaller steps forward over time. Cigar sales. What's the summary here for this section? Similarly, this is all new compared to what we have right now.
Mm-hmm.
Mm-hmm.
Okay, can you summarize what this is trying to tackle?
Yeah. I'm not exactly sure. It sounds like pre-packaging and taking out and repackaging them. I can't remember if I had any notes on this.
Seems well, and call me crazy. I feel like A and B are identical.
Yeah.
Maybe my eyes are missing something, but it's somehow nobody can sell basically a package of 2 or more cigars unless it is priced accordingly. So I feel like it's trying to say you shouldn't be allowed to sell more bulk packaging at a low price to try to
Yeah, if you get like a box
access
of
to it.
cigars. Yeah. So I guess you could order a box and then individually wrap them and sell them for different profits. I don't know.
Okay.
I'll get back to you with an answer on that.
Yeah, is that what it is? They don't want somebody buying a box of 20 and then trying to sell them at a discount.
That's
But
what
that
I
would seem
think.
weird because it's not saying you can't sell individuals.
I think it's not worded well. I think I'm not sure if it's meant this way, but I think it is meant if it's packaged 2 or more. So you can't buy a box of 20 and then sell singles unless it's designed to be sold as singles. If I'm buying a $40 single cigar, that's fine. If I'm buying it's the old cigarette thing of selling Lucy's, for a quarter a piece thing. I think that's the intent, but it's not worded very clearly. So it's 2 or more, making it a package of more than one. You can't break up a package of more than one and sell them as singles unless they're designed to be sold as singles. But it's worded very poorly.
I wish that's what it said, Dan, but it really does say any original factory wrap package of 2 or more cigars must cost at least $6. That's really what it says.
No retailer or person shall sell or distribute or cause to be sold or distributed any factory wrap packages of 2 or more cigars unless
Yeah.
Yeah, no, you're right.
It's really just saying if you're selling something that's 2 or more cigars, it has to meet a minimum price.
All right, we'll get some
I
clarification.
apologize.
Yeah,
I apologize because no, it's originally it sounded like the Lucy language.
No,
You know,
I wish it was what you were describing. That would make more sense. But this is, and it is also is saying that the package could be 20 cigars and still be $5.80. Yeah, that'll be curious just to see where this comes from so that we can understand the rationale behind it so that we can support it.
Fair enough. All right.
And then the next section is about basically, closed door commercial operations that are working on distribution outside town. And then obviously if we put in some sort of cost thing, we have to then amend it periodically. Okay, next, sale of flavored tobacco products prohibited.
So this was new for 2019. So only the green would be differences from 2025.
Okay. So previously, in our current regs, we do not have a prohibition on flavored.
It wasn't addressed at the time, so this would be new.
Okay, so
like Kevin mentioned earlier, it could have been something that was brought up with the Lemonster Alliance.
Okay.
So we're just adding it to the regulation at this point.
Along similar lines, I'm in favor of it. I would be curious to see just current state. So if we have something already that is a prohibition, great. If we don't, then this could be a change that would impact our businesses.
In general, it is prohibited right now.
Okay, I'm much less flexible on this one, I think, but that's my opinion. Okay, and then we're adding some language on not just selling and distribution, but possession, holding, keeping.
Mm-hmm.
So this stuff can't even sit in our town, basically.
Yeah, we have cited violations for somebody just holding something like coupon cigarettes. Even though they're not for sale, if you have them, they need to be out of the shop, so you can get written up for that.
Okay, good to know. And then we need a space here because then it's nicotine content in electronic nicotine delivery systems. So this is just similarly a limit on the quantity of nicotine in these products. And then last here we have prohibition of the sale of blunt wraps. Similar discussion. That's a new thing that's not currently prohibited.
Correct. Yeah.
Okay. Thoughts? No one. All right, moving on. Free distribution and coupon redemption and discount pricing.
So we don't allow that right now anyway.
Okay. So that without going through every word, that this maintains that prohibition?
Correct. Yep.
Okay. I assume the same on out of package sales?
Yes.
Prohibited and remain prohibited?
That's correct.
Okay. This section got a lot longer.
It did.
Why? There's some hazardous waste information if you're doing liquid nicotine containers. And more about liquid or gel nicotine. And no refills.
Good.
Okay. Self-service displays are prohibited. No vending machines. Adult-only retail tobacco stores are exempt from this section. So, why?
I think the idea is that for adult smoking, you need to be ID'd to even walk into the building, so that you are of age. So it's self-service because you are over 21. They verified you're over 21, so you can have access to pick things up, look at them. Where at a gas station, it's truthfully too easy for a young person to come in, look at something, drop it in their pocket or their bag, and walk out.
But
So it's
self-service is really like vending machine style.
Nope. So vending machine is a separate line. Yeah, but no, self-service displays is that difference is that is it behind a locked cabinet or a door or a counter, or can someone walk in and pick it up?
Pick it up off a shelf. Okay.
Yeah.
I get it then. Okay. Then yes, you're right. Vending machines are the next one, which are prohibited. And then we have non-residential roll your own machines. I gotta be honest, I don't even know what this looks like. Do you like pour your own tobacco in and it rolls it for you? What does a roll your own machine do besides roll your own?
Must be commercial. I don't know.
We'll assign that to Kevin Davis to research and provide us with a PowerPoint presentation.
Excellent. Okay.
Okay, here comes the healthcare institution. So no healthcare institution shall sell or cause to be sold tobacco products. Why is this here?
I've never seen something like that, so I'm not sure.
I guess anything is possible, and it just means it happened somewhere at some point, and now there's a line item about it.
Well, I mean, for a long time, you know, drugstores and CVS and stuff sold tobacco products. It's only been probably 10 years that CVS has gotten rid of tobacco products. So I think this is just, instead of voluntarily, it's just making the order of healthcare institutions will not do it, and including pharmacies, etc.
Fair. And this is saying that a retail establishment that has a healthcare institution component, such as a pharmacy, optician, optometrist, drugstore. So curiously, a healthcare institution in the definition specifically excluded optician, optometrist, and a few other items. Yet here it's saying such as falls into the healthcare institution definition. So those conflict. So either the definition up top needs to be more broad, so that this calls out that if you're a retail establishment that has some sort of healthcare service, including an optician, you also fall under this umbrella that you are prohibited.
And the definition and that line are both from the model regs from DPH, right, Francis?
Correct. Yep.
All the red is model regs.
Yes.
That's
Well, yeah, but this has the green section.
so. Yeah, is that it's red and green? So is that model regs with edits? Is that ours added on?
So the green is suggested edits that the board would have to make a decision on. Red are already instituted.
Okay, so if we want the language down below, this green cannot exist.
Yeah, I guess so.
Because otherwise there's the conflict, because then you're saying,
Or we could just
It's-
take out the shall not be considered and just say shall be considered.
or do we add them to the list up above? Because this is giving the examples, not limited to hospitals, clinics, health centers, pharmacies, drugstores, doctors' offices, dental offices. While I don't necessarily consider an optician's office a healthcare institution, I don't like that version. I also don't think that tobacco sales should be permitted in an optician office. So I would rather they actually be called out specifically as included, so that the language down below matches, or we leave the definition of healthcare institution and we list them separately down below. But that's my opinion. Other thoughts from the board when we're talking about optician, optometric, hearing aid, audiology, retail outlets? Should we specifically restrict them?
I think they all count as healthcare providers or healthcare organizations. Let's be consistent across. If I'm an audiologist, I can sell, but if I'm an optometrist, I can't. You're providing healthcare of some form. I think we'd leave them together as one group, but that's just me.
I agree.
Kevin, did you say you agree? Okay. I agree too. So Francis, let's add on those additional options as examples of healthcare institutions called out here. And then it'll match down here.
Okay.
Let me try to find where we were. There we go. So then this will match. And then this language can stay. I would add just to call out audiology here. After optometrist.
Mm-hmm.
Because this is a slightly different language, because this is talking about a retail establishment that has basically provides some of that healthcare service that we're listing out, which, like to Dan's point, that could be a drugstore, which was specifically called out earlier as a no-no. But here, if for some reason you are a grocery store that then has a minute clinic in your establishment, I guess I can't use that. That's probably a brand name. But a advanced healthcare provider providing some healthcare services. Or honestly, Costco with an audiology department would fall into that, because that would be a retail establishment that then has that healthcare service within it.
Okay.
Okay. So next section, prohibition of the sale of tobacco products by educational institutions. I don't think there's going to be a lot of debate there. This is new language.
Yep.
Okay.
Someday those children will really appreciate what you're doing right now.
Now, technically, educational institution only was primary and secondary school. Not that we have any other educational institutions in town. Should educational institution, if we're going to go to the point of calling this out and saying, by the way, you should not be selling tobacco at these establishments, should educational institution include test prep companies, after school program companies, study help companies, those kinds of things?
I think every other town should do the same thing we do, to help those young kids not to get sick by smoking cigar or cigarette, or even taking drugs. We have to help them.
I agree. That's what I'm throwing out there, Gino, is that because it's been called out, do we say educational institutions and establishments and includes those kinds of places that are basically, the business is providing education services to minors outside of a brick and mortar school building?
You're doing a good job.
Sorry, I'm trying to look back to see what was the definition of educational institutions.
Yes, I can do that. It was brief. If I know my alphabet. Here we go. Public or private college, school, professional school, scientific or technical institution, university or other institution. I swear that's not what I read somewhere else. Oh, maybe it was school. Sorry. School is defined as public or private elementary or secondary school. Educational institution is further public or private college, school, professional school, scientific or technical institution, university, or other institution furnishing a program of higher education. So it still is a very traditional school definition, but includes college, university, trade school, etc. But it doesn't include those non-school commercial operations that provide education services.
That is true.
I certainly can't. I don't see a need for your local test prep school to be selling cigarettes, next to the SAT books. But I also not necessarily see that ever coming up. I don't know.
I'm with you. I don't want to add stuff just to add stuff, but at the same time, this is one that just sticks out to me to say, like, well, we're calling out that you can't sell them in a lot of just kind of oddball places. So why wouldn't we also call out that you can't sell them there? But maybe that opens the door to too much thinking about, are there any other places that we would like to restrict the selling of tobacco products? And maybe that just warrants some thought and consideration from this board to say, are there any other businesses? Now, granted, we all go back to the fact that our licenses are capped. So this is all just something way down the road for when some establishment someday closes or decides to give up its license or loses its license, and then some other business asks for one. But Dan, I know you always like to say, like, if we have some reg that we can point to that's really clear, when somebody then asks the question sometime down the road to say, hi, my SAT prep center wants to sell cigarettes because,
and nowhere in here that say I can't.
Right? We all of a sudden all cringe because we never said that was a bad idea.
The whole founder's intent. We never planned for this.
So I think we should. I would lead towards, let's brainstorm. Let's at least not close the door on it, and let's think to ourselves as a board. And Francis, you think about it, give some input, and really come up with: is there any other retail establishment or other commercial establishment that we should say, no, you know what, that should not be done? I mean, it technically doesn't say we can't sell them at the library, for example. But is there some restriction at a higher level against public buildings?
I believe there is. I'll look into it more, but I'm pretty sure.
Because honestly, that would instantly cover some of your schools as well.
I'll look into it.
Okay. Incorporation of state laws, state regulations, just new language. You've got to follow the state as well. Okay, violations and penalties. Choose option 1 or option 2 below. I like having choices here. Option 1 is a fining structure that creates separate fines for state laws and local policies. And then where is option 2? Option 2 is a long ways away. Create separate fines for state laws and okay. I don't want to go through all of this. This seems quite complicated, and I feel like, Francis, on this one, could you make a suggestion based upon, or if you already have an idea, please tell us now. based upon how we work with the Tobacco Control Alliance, what we've done historically, and which option we should actually be looking at?
So I believe we follow option 1 right now.
Okay. What does option 2 do dramatically differently? Do you know at a summary level?
I didn't read too much into it, no.
Okay. Let's assume we're going to do option 1. We can discuss a little bit, and then you do a little further analysis. And if there's something in option 2 that jumps out as awesome or whatever, bring that back.
Fair enough.
Okay. And similarly, this is all well described in what we've done historically. Correct? Oh, sorry, Kevin, you raised your hand.
I do believe our current policy is more in line with option 2.
Oh, is
Okay.
it?
Yeah.
Okay. Okay. In that case, I'm going to punt this. Kick this part down the road. Let's compare it to what we currently have. Say what we're kind of following, and then say if there's some sort of pros or cons of switching options, as it were. And then any of the yellow language, I would just say call out where it's changing from what we've done historically, so we can decide whether that's a good thing or a bad thing.
Okay.
Fair?
Yep.
Okay. Sorry, trying to keep track of headers. Okay. Renumbering. Separate violations. Enforcement. Severability. That's it. So, lots of follow-up for Francis. Sorry. And next thing I think would be another discussion before we get this to a public hearing.
Okay.
That way we can make sure the language we feel like is all pretty tied up. Then we can go get a public hearing about it. Does that make sense?
Yep.
Okay. Any other thoughts, comments, questions on tobacco regulations? Thank you for bringing this to the board's attention and making sure we can get things updated. We have no attendees, so I can't really ask for anybody to raise their hands or provide input. Next is our 710 agenda item on the infectious disease decision support tool. Please hold. Okay, so this is not going to be very exciting because all sorts of things have changed in how I get data. So the CDC does not appear to be reporting variants anymore. So they have a whole new dashboard that I kind of want to dig into to see if there's data that we feel like is helpful for us to report. Similarly, our chart on Littleton weekly case counts, as well as our update date vaccinations, have not been updated by Massachusetts since the summer. And it says that they will be updating those, but I'm a little disappointed that we should be getting people vaccinated at this point. It's fall, it's late October. Vaccinations are recommended right now. So I'm not sure when Massachusetts is going to start reporting that. And Francis, that's a question of, do you have some contact or connection that you can make within the Massachusetts DPH to say, how's this data working, or who we can go to for questions about that?
I'll have to ask around to get a source, but yes.
Okay. This source right here, which you can access this file and click on this link, that takes you to the page where I usually get this data that has the dashboard that says the season ended on June 28th, period. Information for the upcoming season is not yet available, likely later in the fall. That feels kind of vague. I wish that was updated to at least say something closer since it is fall, if they had some information on when this is going to start providing data to us. The wastewater numbers do continue to be reported. They're kind of in the right around 200 level. Our arbovirus season is hopefully over. So those have been unchanged since kind of late in the summer when West Nile virus jumped to moderate. Influenza report has opened up again for Massachusetts, so it is new. We are at low right now. They've also added information on just upper respiratory illness. So I'll look at that data to see if there's something helpful to report. And then similarly, the vaccination data is not current at all. And then RSV at the CDC level, it looks like that season has started. So I'll start looking at that data again as well. What I will say is that vaccinations appear to be readily available. If you have a health insurance provider that is not based in Massachusetts, then you might have an issue. That just depends on the health insurance provider. But from what I understand, Massachusetts, if you have a provider based in Massachusetts, you're going to get covered. But if you try to get a vaccination outside of Massachusetts, then again, it's also variable. So I know, for example, if you want to go get a COVID shot in New Hampshire, you will be less successful getting that covered or have access to that service. But we have them. And Francis, remind me about how our public clinics are laid out right now.
So we just had one yesterday. And then we had one at the end of September. Last night we had 151 people attend. I'm still waiting for numbers on COVID versus flu. In comparison to last year, we always host this clinic for the all ages at middle October for flu. So we did actually do higher numbers this year than we did last year.
Good.
The senior clinic, we haven't gotten a definitive number yet, but I believe we were looking at 288 vaccinations total. So I'm just waiting for a breakdown.
Okay. And then any further clinics planned or scheduled?
So we're going to talk to the Littleton Volunteer Corps, and we're going to talk to the pharmacy and see if there's any interest in doing one more clinic.
Okay.
We've also kind of talked about maybe next year doing a first responder clinic, if there's any interest in that as well.
What do you mean by first responder clinic?
Oh, sorry. So fire department, police department, maybe add in town staff as well.
You mean, I'm asking more. You mean a clinic for those people to get vaccinated, or a clinic operated by those people, basically?
Sorry. Yeah. No, this would be for them.
Okay.
Allow them to make their own provisions, but I don't know if they would have an interest in just doing it in office or something like that.
Okay. That was an idea that I came up with because I got mine done, and as usual, felt not exactly 100% the next day. And I thought, boy, wouldn't it be nice if we were able to kind of get like all the kids who want vaccinations done on the same day at school, and then the next day is actually a day off from school, so that nobody has to miss it sick because they don't feel good from their vaccination. But that's a wish maybe someday down the road, if we could have a system where we actually had better access for people, and then also a kind of a safety net for the next day, because I think that's hard for people, especially in probably the first responder role, is you have to look at saying, well, I can't really miss my shift tomorrow. I don't really want to be operating at 50% tomorrow, and therefore I don't want to get it today. But then you're left with having to get a vaccination before your day off, which is always kind of a bummer too. So yes, I applaud. Keep looking into kind of other ways that we can try to figure out if we can ease the burden on people. And maybe for town staff, it's crazy, but maybe they all are able to get on a Thursday since town hall closes early on Friday, so that everybody only has to suffer, as it were, through a half day before they can kind of recover for the weekend. But I'll throw
An
out
interesting idea they floated was possibly doing a town meeting too, but that might be challenging.
hey, it's As long as you feel bad the next day, I'm okay with it.
Yeah, it's after the vote.
So, yes, please keep trying to explore ways we can do this. I'm glad that the numbers are up from the clinics we're providing. I'm worried that the numbers are not going to be appreciably higher just globally based upon what the recommendations have come out and said and access. So hopefully we can still get people vaccinated and have a good winter avoiding the flu and COVID.
We've also made a flyer that will go out tomorrow. It kind of breaks down what the DPH's recommendations are, easy to understand for people, just to throw it out there.
Awesome. All right. Anything else on infectious disease? Brings us to our 7:20 agenda item, administrative matters. So we have meeting minutes approval from September 24th. I have lost that. 1 second. Lost my packet. 1 sec. Okay.
No, I don't think we'll be able to approve those tonight.
Oh, that's what I was going to check. Okay, we cannot approve those because we don't have enough members present who were at that meeting. So, Francis, please make sure that gets onto our next meeting.
Will do.
Any other administrative matters? Francis?
We were contacted by Emerson asking if we wanted to participate in the Yellow Tulip project again this year. I said yes.
Okay.
We got 100 bulbs. I'll be planting again myself, and we'll see how it goes.
Remind everybody listening about what the project is, please.
Sure. So when tulips grow in the spring in a big bunch, it's supposed to signify mental health awareness and stigma and togetherness, and how if you're going through any struggle or situation with substance abuse or what have you, that there's always a community and always people there to help and support you. I hope we grow this in the next couple of years to be able to almost have like events annually as part of it. So this year, once they grow, we'll have 200 tulips. So keep going this way. We might have a really big tulip bunch that will look really well for the upcoming events. Westford currently does an event each year, and so I think we'd model something similar.
Cool. And where are the plantings planned?
So believe it or not, it's very hard to find any place to plant in Littleton that they'll allow. Originally we wanted the common, but we were told no. So they are planted at the library. We would like to be able to plant them at the COA because they have a decent display up front and they have so much traffic going through there right now. But I was told there is something about a warranty on landscaping that might cause an issue. So TBD.
Give us some more information at some point about other places like the Common, because I think it would make sense if there was something that we could create that, obviously not just all over the place, but if there's something specific, I think we should at least consider it, or not just consider the door automatically closed. Let's have some conversation about it. And then I don't know. I mean, are school grounds okay? Does the high school have a spot?
They weren't really interested at the time. We can always revisit.
Okay. Cool.
We're also applying for a grant through Emerson Hospital to put more funding towards a program we have right now called Memory Cafe. It's for residents who are suffering from Alzheimer's disease. Basically, it's to promote socialization, not being isolated, mental health, where caregivers and those affected come in and have a kind of social opportunity. So we're looking to build that program because it's kind of small right now. So it'd be another $8,000 per year.
Okay.
Lastly, the public health nurse next week has a meeting with all the school nurses. That's the first time we've been able to kind of get everybody together. So our discussion with them is going to be about how we can do public health education and bridge the gap between the schools and the health department.
Awesome.
That's all I got.
All right. Before I jump to board members, there's Be a Good Neighbor in our packet.
Oh, that's a flyer we just came out with. It's for seniors.
Okay.
So as we are building more materials, I just want to get out to the board as we do it, but there'll be a lot more coming.
Question.
Mhm.
Are we leveraging EHS's social media presence, or are we building our own as a health department?
We don't have any right now, but I think the goal would be to have our own and not latch on to EHS or, I mean, we're trying to make an identity at this point, and so we're just branching out, but we could latch on to their social page. It's going to be a broader conversation with the board, I think, as an agenda item, because it's not typically, they don't allow everybody just to do it.
I'm just thinking in means of how to get that flyer out to people.
So what we'll do is we'll send it out. No, it's a very good point. So what we'll do on our side right now is we'll send it out through news and announcements for the town. So anybody who has signed up for any notifications for the town will receive it. And then we'll also post it in town at all the public buildings, and we can ask private institutions if they want to post it as well.
Great.
And then the only other thing in there was the flu and COVID clinic that you already mentioned. So
We are in the process of keeping track of numbers, but we're also gonna do by age groups, so we can see how the metrics change over the years, which I talked to the vice chair about last year as well.
all right, thank you for all that, Francis. Lots of updates. We'll wrap up here with board member updates and any other comments. Anybody like to go first? Great, Kevin, go ahead.
I have no updates.
All right. Gino,
Yes, what?
do you have any other updates or comments to make generally?
I think you guys do the best you can do. The question is, I hope the people that sell the cigarettes, whatever, cigar, to say to the kids when they come in, would you be kind enough to show me your license? Would you let me know that you are 21 and then you can smoke? But it'd be nice if you don't smoke, even though you can afford it because of your age. I met a lot of people, they start cigarette, then they went on cigar, and all of a sudden, after a couple of years, they got sick, and they said, Gino, I'm going to take your advice. I'm going to quit, and they quit. So sometimes their parents, even though they're 21, why you want to smoke a cigarette or a cigar? It stinks. And also it's going to hurt you. This is my thing. I tried one time when I was very, very young. A friend of mine says, hey, we always smoke, Gino. Why don't you take a cigarette 1 second? I took the cigarette my second. My father says to me, come over here, I'm going to give you a hug. He gave me a hug, all right, and a slap in the face because he smelled the cigarette. I said, Pop, I didn't smoke the cigarette. I only took it to make my friends happy. And he says, you're going to make me happy. Don't you ever come home and when you give me a hug and you smell cigarette. I learned my lesson because I'm not sick. And a lot of my friends, not only they got sick, they die. You understand that? They die because of the smoke. And I come from Italy, from Venice. I learned my lesson. And what you guys doing, you're doing the best you can, trying to, you know what I mean, to advise. That's a very good advice because you care. You know what I mean? That's what happened.
Yes. Yeah.
No
Thank you,
drugs,
Gino.
no cigarettes, no nothing.
Yep. You were lucky to have somebody to help keep you from hopping on that train.
Yeah, I had a lot of people that helped me too. They were very proud of that I took an advice of my father. Yeah, I was very lucky, and I
All right.
lost so many friends just because they were smoking. When I went to back to Italy, my friend there was smoke, and he was a son of a doctor. I was surprised. He had a big hole here, and he still was smoking. When I left to Italy, I got a letter from their mother. I'm so sorry. I was very happy to see you, Gino, with my son, but now he passed away. And I know why he passed away, because he was smoking. Somebody calling. Who called? Message.
Oh, sorry, Gino, we lost you there. All right, Dan, any updates?
No, just a quick one to tag on to Francis's. This is Mental Health Awareness Month, as we learned. Certainly, if you or a loved one is in distress or has needs, reach out to your primary care, to friends, family, and certainly 988 as a emergency easy contact is always available as well. So if you're having concern, stress for yourself or for a loved one, reach out for help, because that's why we're all here.
Yes, indeed. Thank you. I do not believe I have any further updates.
I'm very happy that I was able to get to the meeting because I had a problem with my computer.
Oh,
It's okay now.
well, yeah, this worked okay for us.
I missed you guys, that's all.
We want you to be here. Yes.
Yeah, I was very happy when this thing was working. I went to see Francis, and I apologize because I couldn't be to the meeting. Now I'm in the meeting, so. And you're doing a good job.
All right. So our
Hope the
next,
kids understand that.
due to a wonky month, it looks like our next meeting is going to be November 12th. So we skip a week because it's a second and fourth. Okay. But that should be long enough to get some feedback on the tobacco regulation, right, Francis? Okay. So I would like to, as we're getting into that season now, so I would like to make sure we keep that meeting on the schedule, November 12th, because the following meeting will be November 26th, the day before Thanksgiving, which I am guessing that Kevin's already shaking his head no. So Kevin would like to not have that meeting. And I think we usually cancel that meeting. And then that leads us into December, where again, it would be December 10th and then December 24th, which is also a not popular day to have a meeting. So let's make sure we have the meetings on the 12th and December 10th, and then we'll deal with the new year. Sound good, all?
If any crises come up, we can always try to schedule a special in between there someplace.
Correct. And Francis, I think the other thing we could do is, because we have an extra week right now, if you want, we could look at doing the 5th and the 19th in November, which would give us one extra meeting between now and the end of the year.
All right, the 5th and the 19th.
Yeah, because that would be 2 weeks from now, and it would stay on a 2 week cycle. But I know that's not just up to us. That's making sure we have our video resources and people's availability. So I think sort that out over the next few days, just so we know. But if you feel like there's kind of enough activity or requests coming in, then I think that's an option we can consider.
So you let us know when is going to be the next meeting, right?
Yes.
Yep, I'll give you a call, Gino.
Okay, thank you.
Okay, that ends the logistics then. I have nothing else. Kevin,
Mr. Chair, I'd like to make a motion to adjourn.
I second.
motion and a second. Roll call vote. Kevin Baker,
Kevin Baker votes yes.
Gino Fratelloni,
Yes.
Dan Kane,
Dan Kane votes yes.
and Matt Wason votes yes.